In this episode, we talk about how to improve your thoracic spine mobility.
Get up and get down, get up and get
I want you to have the capability to fully move the way your body was designed to, right?
Jump of a head, I'll take you back to where my problems lie. In trouble, younger daughter done some that made my mama cry. Out to the heavens like I bless him, for I know he's lost. Caught in a trance and this manic depression settled in. Living in the fantasy world.
Hey, what's up everybody? I'm Dr. Horschig from Squat University, and this is episode 8 of the Ask Squat U Show. Hope everyone's having a great week so far. Let's not waste any time. Let's get into today's question.
Josh Wolf 27 asks, I just had a quick question. Could poor thoracic mobility be the reason my low back gets very tight and painful the day after squatting?
So today's question revolves around the topic of whether or not thoracic spine or mid-back stiffness can cause back problems the day after squatting. The answer is yes, and here's why. Human movement is so complex that it lends itself to the illustration of a symphony orchestra that's composed of hundreds of different moving parts. The same goes for our body that is composed of many different muscle actions. We have some muscles that create movement and other muscles that hinder movement or stabilize the body. And when all these things come together, just like an orchestra changing tempo and uniting all together for a perfect sound, our body, when all these muscle actions come together, we can create perfect movement. So we have to really understand the intricacies and how the body connects, some muscles hindering movement and some muscles producing movement, to actually understand how thoracic spine stiffness can relate to low back pain. So this brings us now to definition time. There's two things I want you to understand. What is mobility and what is stability? Now, mobility is basically the ability for an area to move. Now, technically, people will say it's the ability of a joint or a joint complex to move freely or unrestricted. Now, what is stability? Well, that's the ability to maintain position or limit unwanted movement at a joint or joint complex while motion occurs elsewhere in the body. Basically, how well can you control a certain part of your body? This is synonymous with what people will call motor control. Now, based on these definitions of mobility and stability, we can use them to help classify certain areas of the body that would benefit from more mobility or more stability in order to see perfect movement. Now, obviously, these are vast generalizations, but we use these because we find common tendencies and problems in the body when an area lacks mobility or lacks stability that leads to movement breakdown and eventual injury. For example, let's talk about the spine. Now, your lumbar spine, your lower spine, is an area that requires stability. Now, if this area lacks stability or you have excessive motion down there, especially when barbell training, it's an area that can easily accrue a lot of forces that can lead to pain. This is why many of our core exercises are geared for stability. Now, that's different than strength because remember, strength is only your ability to produce excessive power and force. Stability, like I said, is your ability to limit excessive movement and maintain position. So this is why endless crunches can't necessarily help you snatch more weight, because you want to be able to limit the excessive bending or flexing whenever you're doing that movement so you can transfer that power from your legs into the barbell. Now, thoracic spine or your mid-back is an area that's already very inherently stable. It has to be to protect all your vital organs. However, we find that when we improve our mobility in that area, it really helps our movement look much better and it affects the rest of our body. Think about this. How often throughout the day are you in this position, looking at your phone? Today, many people have crappy posture. And a lot of it has to do with how we hold our body with our smartphones, right? Now, if you improve that ability, it's obviously going to carry over to many other things. It's really hard to front squat or overhead squat with a very rounded thoracic spine. Now, let's say someone has a pretty significant amount of thoracic spine stiffness from sitting all day and looking at their phone. So what's going to happen is that their body's naturally going to be a little rounded. Now, obviously, this is a little excessive, but this is what we're looking for. This curve is thoracic spine stiffness, like this. Now, whenever that person goes to front squat, they obviously aren't going to be able to get their arms very high. What that means is that in order to get into a good position, obviously because they can't move their thoracic spine, they have to find that movement somewhere else, which means that they're going to move excessively from the lumbar spine. Now that's an area that should be very stable. So we just made it unstable because of stiffness somewhere else in the body. So because the thoracic spine wasn't mobile, it caused the low back to become unstable. So this is what it would look like. In order to front squat, because we're here, now we want to be able to have an upright chest, right? Because your coach is yelling elbows up, big chest. This is what happens. My low back just arched excessively. You didn't change anything in your thoracic spine because it's stiff. However, by moving that lumbar spine excessively now, overarching it, you just created a more upright chest. You got your elbows up, but you did it in the wrong way. Now what we're going to do today is show you a few of my favorite ways to improve thoracic spine mobility, and then one of my favorite ways to then improve lumbar spine stability. Because it's not about treating one or the other. You have to treat both if you want to solve the problem. Now, one of my favorite ways to improve thoracic spine extension is going to be with the prayer stretch. Now, this is very similar to the yoga pose called child's pose. What you're going to do is get down on hands and knees. We're going to put your hands one on top of the other, and we're going to let our chest drop all the way to the ground as we're reaching over our head. What this is going to do is be a very good lat stretch, but if you have a significant thoracic spine limitation, you'll feel pretty good in the middle of your back. While you're there, you're then going to let your breath out for a couple seconds. So hands together, sit your butt back on your heels, put your head all the way down, and relax your mid-back. And back up. And what I want you to do is hold this for about 5 deep breaths, in and out. And you should feel a pretty good stretch in your mid-back. Now for some, you're going to want to go just a little bit more advanced, and get your hands a little bit above your head. So what you can use is a foam roller to do that. So it's the exact same movement. Now you can put your hands together, you can put your hands up and at different angles. Try and see what you feel when you're doing those. So here, hands down, and back up. Now again, I want you to do about 5 deep breaths with that. You should feel a very good stretch in your mid-back. So that is the prayer stretch for thoracic spine extension. The next exercise I'm going to show you is called the open book. And this is a very, very good exercise for improving the rotational capability of your mid-back. So what you're going to do, find a foam roller. You're going to lay on your side. From here, we're going to put our top leg on the foam roller, and we're going to keep it there. Now, while we do this rotational movement, the reason we keep the knee there is to limit any motion from the low back so we can bias our movement in the mid-back. Hands are going to be together, and from here, we're going to keep our hip up and down like this, knee in contact, and we're going to rotate backwards. Up, you can even follow your hand with your head, and you're going to feel a very good stretch in your mid-back. You're going to hold it for about 10 seconds, and then close the book. So again, open the book, feel a really good stretch. My knee stays in contact with the foam roller. 10 seconds, and then you're going to close it. Pretty simple. That is the open book stretch for improving the rotational capability of your mid-back. So the next way I'm going to show you to improve your thoracic spine extension is with a peanut. Now, this is called a joint mobilization. What this is going to do is actually affect the way that your bones are moving through external pressure. So what we're going to do is use this peanut by laying on our back. Now, you're going to position this right in the middle of your spine. The part of your spine that sticks out is going to go right in the middle of this peanut. You're going to be down on the ground. Now, don't start too low on this or you're actually going to feel it in your back. From here, what you want to do is brace your core, and you're going to do a small extension and small sit-up, just like this. What we do not want to do is this. Where did I just get all that movement? Right from my low back. So this is a very small motion. I see a lot of people do this wrong by doing a ton of motion and getting it all from their mid-back or their low back. So from here, it's brace the core, hands here, a couple, up and down, maybe 15 total. Then I'm going to take my shirt so it doesn't pull it up with it. I'm going to slide to the next spot, just an inch or two up. From here, again, I'm going to do a couple small sit-ups, working back and forward. And what that's doing is it's pushing on the actual parts of my spine, and you'll find that some areas may feel a little bit more stiff than others when you do this. If you find an area and it feels like it's moving well, you don't need to spend much time on it. But just from here, a couple sit-ups, up and back, keeping that core braced. Don't move too much from the lumbar. and then back. So that's a thoracic spine mobilization. What you can do, some people will like to use a roller. Now this isn't going to actually affect the small parts of the lumbar spine as much as using a peanut because of the position of the actual lacrosse balls. But what you can do is from here, extend just a little bit, and then back. Same concept. We want that core to stay braced. What you do not want to do, and again, is what I see a lot of people do, is this. You're not doing anything for your mid-back. You're getting all that excessive motion from your lumbar spine, your low back. So we want to keep our core braced, hands here, and it's a very small motion just at the mid-back. And again, you could do a couple reps of this, and then back if you want to. You could put your arms over your head, and then back. But again, bias it at the mid-back. Don't let your low back move excessively. This next one I want to show you is great in that it really carries over to the front squat position, which our question really pertains to. Now, what you're going to do, it's very similar to the original prayer stretch, except we're going to be modifying it slightly. What you're going to do is find about a box about this high. You can use a bench if you want to, and you're going to grab a PVC pipe, something really light. Now, our goal is to have our elbows in close with our hands in a V position. If you need to, you can have a partner on this side of the bench that's holding your elbows together. What that's going to do is also work on your external rotation of your shoulders a little bit. That's why it's so good. So what we're going to do is get our hands in about this position on the box. What we're going to do is brace our core so we don't get too much movement in our low back. I don't want to see excessive arching like that. And from here, we're going to do just like we did with the prayer stretch. We're going to tuck our chest all the way down, let some of our air out, and allow that to really feel a good stretch in our mid-back. So from here, sitting our butt back, drop down until I feel a good stretch, and back up. You'll feel this in your lats as well, and in your shoulders sometimes if you have really limited shoulder movement. Keep that butt tucked so you don't get too much extension in the low back. Again, back down, and then up. There you go. The last thoracic mobility exercise I'm going to show you is called the deep squat rotation. Now this is going to be a little advanced for some people, but for some of you, you're going to really feel a good mobilization in your mid-back. What you're going to do is assume a very deep squat all the way down. You're then going to take one hand, grab your foot, and with your upper hand, you're going to do that same mobilization rotation that you did with the open book. So from here, we're going to take our hand up, and then back down. We're dropping our shoulder towards the ground and up, keeping both feet flat on the ground. Again, we'll take our left hand, grab your foot, take the right hand while you drop your shoulder to the ground, up and back. You'll feel a really good stretch in your mid-back and maybe get a couple of pops prior to your workout. So that's the deep squat with the rotation stretch. Now, once we've taken the time to improve our thoracic spine mobility, we then need to do an exercise to improve our lumbar spine or low back stability so that we can prime both parts of our body to work in unison as they were meant to be. Now, the exercises we've been doing have been to improve our thoracic spine extension so that we can limit overextension from the low back. So I want to show you a core stability exercise that can work on improving your stability to limit excessive low back arching, basically. What you're going to do is find a band. I have this hooked up to the rig here now. This is a very light band. What we're going to do are static raises. All you're going to do is face away from the band. You're going to get to a small squat. I want you then to brace your core nice and strong, like someone's about to come up and jack you right in the stomach. Once you've braced it, you're then going to take your arm, keep it straight, and raise it straight out in front of you. And back. Now, if you're doing this correctly, your low back will stay stable the whole time. The further out you raise your arm against the resistance of the band, the harder it is to maintain stability. What you'll find is that some people will do this. They'll raise their arm out, and instantly their low back will move as a compensation for poor core stability. So for something like this, I'll probably do 2 sets of 10 to 15 reps with holds, working on bracing first and then moving, and that's a great way to prime that core stability that will then transfer over to your barbell lifts. So again, small squat, brace your core like someone's about to punch you, raise up, back down. There you go. So there you have it. There's our couple thoracic mobility exercises and a core stability exercise that can fix this problem. Physical therapist Greg Cook, the author of the book Movement, the founder of the FMS screening, once said, "It's not about which came first, the chicken or the egg. You have to catch both or you can't manage either." And that's really the mindset we have to take when you have someone with back pain or thoracic spine stiffness. You have to be able to address both. Question of the day. What is your most common injury that you have occurred while in the weight room? Personally, I get a lot of left shoulder or left elbow pain from time to time, so that's an area that I constantly have to focus on with my own training. I hope you guys liked today's Ask What You show. If you did, please share with your friends. Subscribe to the channel, please. I hope you guys are all enjoying these shows, and happy squatting.
Hometown hero on the road doing shows and sold out arenas. You can call me what you want, but you won't ever slow my dreams up. This is the vision of a dreamer. I seem to